Power matters in health. When we talk about power, we're talking about the ability to essentially decide what happens in a community. So we're talking about essentially community level power, what we refer to as community agency. And we basically theorize that if we could build social, political, and economic power and a critical mass of people in 14 low-income communities that have documented health disparities, that we could improve the health status of those populations over a 10-year period. And so, unlike most of what are essentially created as health interventions at the community level, we weren't thinking that there was something that we needed to do to people. In other words, it wasn't like increasing access to healthcare or, enhancing the quality of public health education. This was fundamentally about unleashing the power of communities to essentially more effectively hold accountable those instrumentalities of government, that shaped how resources were distributed. And it's funny, people said you're doing something really radical. The reality is, if you look at the history of the United States and you look at any meaningful social change that's happened, even seatbelts, or mothers against drunk driving, it has all come through organized community efforts to change policy. So it wasn't all that radical. It was just sort of a recognition that health is like everything else. There's a role in how we organize our society that essentially has profound health impacts. And if we want to undo those impacts, we can't just try to repair them after they've been created. We can prevent them through good social policy.